Hi there, good afternoon everyone. I'm Rendy Murphy, Epidemiologist and Director of Disease Surveillance and Environmental Services here at the Mobile County Health Department. Here to give you our daily Facebook Live 2:30 update. It's been a busy weekend. This is a brief summary of the worldwide counts as of this morning. Worldwide, 4.1 million confirmed cases of COVID disease with 283,000 deaths. In the United States, upwards of 1.3 million confirmed cases with nearly 80,000 COVID deaths. In Alabama, we're almost at 9,000 confirmed cases of COVID, may even be there now since it's been a few hours since this report was generated. So with 393 COVID deaths. And in Mobile County this morning, we're reporting 1,478 persons with COVID-19 disease, with 186 of those, or 12.6%, hospitalized, and 85 or 5.8% died with COVID disease. I want to comment briefly on something that was brought to our attention actually last Friday. There was for a few days we were calculating the percent of people who had died from COVID incorrectly. And so I went back and checked on my statistical code and got that fixed up. So thank you for bringing that to our attention. And again, if you notice things like that, let us know. You know, there's always an amount of human error that goes into producing these reports, and we want to get them as accurate as we can. So thank you for letting us know. Again, of our COVID cases, we're starting to report out the number that are known to be healthcare workers. That's about 15% of our total population with COVID disease. About 8% are employees at long-term care facilities, and 16% residents of long-term care facilities. We know we have a lot of outbreaks going on in congregate settings. And then I continue to get asked why we're not reporting on how many people have recovered, and I do every day. Of the ones that we know about, around 19% have recovered from illness or were no longer ill at the time that we first interviewed them. Among our 187 hospitalized, about 42% have needed intensive care in the hospital, and a quarter of those needed mechanical ventilation. These are indicators of severe complications that we keep an eye on. And then among those who died, again, the overwhelming majority are 50 or over, with 75% being 65 and over. And around 87% of them are hospitalized. About 94% have known underlying health conditions, and around 50% of those are either residents or employees of a long-term care facility. So before I start answering questions today, we have Brad Phillips, who is our district manager for inspection services. It's going to answer some of your questions related to restaurants and bars.
Good afternoon, everyone. Brad Phillips. We had a question come in specifically asking about inspection services, and are we inspecting restaurants as they are planning on reopening today? Just want to assure everybody that our department has been conducting inspections on a limited basis. While not conducting routine inspections on a large scale, inspection services continues to handle new business, change of ownership, and complaints. Do investigational complaints as they come into our office. Since existing food establishments were never closed to begin with by the health department and their permits are still in good standing, no inspection is required to reopen these establishments. So a restaurant and a bar can reopen with no special approval for them to operate. A restaurant should continue to operate according to best practices standards and follow the state's safer at home guideline or order and best practices guidelines offered by the state, which can be found on our website. We had a question come in about nightclubs. Been fielding for several calls about those as to what is defined as a nightclub, because nightclubs still continue to stay on the closed order. A nightclub, we had some clarification come in from the ABC board, and what they said is that a nightclub is defined as an establishment whose sole purpose is to socialize while consuming alcohol and involve dancing. So at this time, nightclubs are still to remain closed. ABC does have information for nightclubs wishing to possibly change status. Any questions should be given to them for that. I believe we also had another question that came in.
Yes, restaurants are reopening today. Do you recommend that restaurants concerned about space within their dining establishment consider outdoor dining options? Is there a specific recommendation about dining al fresco in this environment?
Okay, the guidance from the state on this has been that there is nothing in the food rules that would prohibit an establishment from establishing outdoor dining. They are welcome to do that. They could not bring in self-service stations or drink stations or anything like that, but they could continue to offer outside dining. Anybody wishing to do that would need to check through the city or their local municipality for zoning and building and fire requirements individually there. So thank you.
All right, thank you, Brad, for bringing that perspective. Now we all know what a nightclub is. See, I believe next week, or later this week rather, there will be some changes to the Walmart testing facility in Saraland. We'll make sure to post those out, but basically because they've not had a high burden of requests for testing, they are moving to 3 days a week and just for a few hours on those 3 days, but they will continue to perform this for several months. So stay tuned for that. We had gotten a question last week about a pediatric multi-system inflammatory syndrome potentially associated with COVID-19. There has been some additional information come out on this. New York is conducting a study to see if this type of illness, some have compared it to Kawasaki disease in kids, but there was a European study that brought this to light, and now a study in New York. CDC is collaborating with them to try to determine if this pediatric multi-system inflammatory syndrome is potentially associated with COVID-19 in children or not. So more on that. You should probably see a Health Alert Network come out from CDC fairly soon on that. Also last week we talked a little bit about changes in guidance for lifting isolation for persons not in healthcare settings. This can get really confusing, so I will try not to make it any worse than it already is. But basically for people who are at home, if you are COVID positive and you are symptomatic, you can either use the symptom-based strategy or the test-based strategy to lift isolation so that you could then move about in the community or go back to work or school. And that is the symptom-based strategy is it at least 10 days past since symptoms first appeared. So that is longer than it used to be. It used to be only 7 days, but it has to be at least 10 days past your first symptom. And you have to be fever and symptom free for at least 3 days. So if you meet both of those categories, then you can lift isolation. The test-based strategy has not changed in that it has to be resolution of symptoms, of fever and all other symptoms, and then 2 negative PCR tests at least, not more than at least 24 hours apart. Sorry. So you have to have 2 negative tests and they have to be at least 1 day apart. So if you are at home and you had a COVID positive PCR, but you never had symptoms, the 2 options for you lifting isolation is again the test-based strategy. So 2 negative tests at least 24 hours apart. And now there is also a time-based strategy for you. So if at least 10 days has passed since the date of your first COVID-19 PCR test, assuming that you've been asymptomatic the entire time. So if you had a PCR positive lab test and you never had any symptoms, then you can lift isolation with the time-based strategy of 10 days. Right. Let's see, here are some other questions. I think that one was answered by Brad. A question here on who decides when hospitals will allow visitors again. I just want to remind everyone that the Safer at Home order that was amended, it still says that hospitals and nursing homes must implement policies to restrict visitation. So the level to that restriction is determined by the facility, not by public health. So the hospitals will decide if they can allow limited visitation, and long-term care facilities may do the same, but we are strongly recommending all of our long-term care facilities continue to prohibit non-essential visitors and workers in their facilities because of the threat of outbreaks. So again, if you are uncertain about what's in the order, go to the website and read it, or you can see our website for all of these guidance documents that are specific to the different types of facilities. There's a lot of information here. There's no black and white. So please adhere to this guidance that elaborates on the Stay Safer at Home order that was amended by the governor that goes in effect today. Let's see. Face coverings, lots of people still saying, you know, we have strongly recommended face coverings. I don't know what the date that was that came out, but it's been weeks, it seems like. So I just want to remind you that a face covering is something that can just be made out of a cloth and some elastic. It needs to cover your nose and your chin. Okay, this is the proper wearing of the face covering. If it has a piece of metal here that you can tighten it around your nose, please do that. But this is how to wear it in public, not like this or like this. Okay, so cover your nose and mouth, please. And as it applies to being about in the community, even I encountered this weekend when I was out doing some retailing that some shops are requiring face masks for anyone who enters and some are not. So we have not mandated face coverings. We have strongly recommended face coverings and strongly recommend that retailers and businesses, you know, have face coverings for their employees and their shoppers and enforce that, but that is up to them. So I personally like to stay out of the places that do not require face coverings because I feel much safer in an environment where everyone is following the Safer at Home order and maintaining distance and following public health's strong recommendation to wear a face covering and stay at least 6 feet from people and wash your hands and cover your cough and stay at home if you're sick. So let's see. Whoa. Sorry. So the Family Health, the primary care division of the Mobile County Health Department, as I hope you all know, reopened today for the most part, our healthcare system wide, but there are some guidelines. You have to have an appointment, and we're seeing in our clinics well patients in the morning and sick patients in the afternoon. So a sick patient is someone who's experiencing an acute episode or illness or injury, right? Chronically ill patients, like those with hypertension or diabetes, can be seen in the morning. So a sick person is someone who has a brand new illness. So I hope that helps clarify that we would like to see well patients in the morning and sick people in the afternoon. If you're not sure, call our central appointment line and they will talk you through it. The reporter that identified that we had some missing data had asked for some clarification. Just want to reiterate, like I said, you know, we're all working at the speed of light and doing things that aren't traditionally our job. So I have several people helping me compile reports every day, and every once in a while we make a minor error and we will correct it as soon as it comes to our attention. And okay, so sorry. I just wanted to make a statement, and then I think we'll have to end for today. We've been saying that now that the state is reopening somewhat, we want those who are at higher risk of severe complications to take better care of yourself. Okay. And so here's, if you're 50 and over with an underlying medical condition, if you're 65 and older, we want you to stay at home and pay attention for potential COVID symptoms, including fever, cough, and shortness of breath. Stay at home and call your doctor. Call your healthcare provider. Let them know if you start to feel severely ill. Let them know that you may have COVID. If you're not sick to be hospitalized, you can try taking care of yourself from home, but you need to know when to seek care. So get medical attention immediately if you have difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, or if you have bluish lips or face. So if you are one of those high-risk individuals and you start to experience those symptoms, contact your healthcare provider immediately. Mark?
Okay, 2 quick questions.
Okay.
There's been a lot of talk, especially in the United Kingdom, about the R-naught values. What does that mean for Mobile County?
So the R-naught basically means the reproductive rate of the virus. So how does the virus continue circulating person to person in the community? And right now, everything we know about COVID in the United States is for every one person who's infected, they can infect up to 3 additional persons.
Okay. And last one, Mobile County is now up to close to 90 deaths. In terms of COVID death rates, there are questions about how coronavirus-related fatalities are determined and whether they are attributed to the virus. Are all of these deaths confirmed COVID-19, and how is the death in Mobile County determined to be connected to the virus?
So 2 ways. If you are in the hospital and you have a COVID positive PCR test and you die in the hospital, you have died with COVID disease. If you die in a long-term care facility and you have had a laboratory positive, a PCR positive laboratory test, and you die in a long-term care facility, the physician will certify your death as dying with COVID disease. If you do not die in a hospital or a long-term care facility, and instead you die at home or in a car wreck or by an accident or some other, natural manner of death, if there's not an explanation for your death and COVID is suspected, postmortem specimens can be pulled, sent to the state lab and to CDC and tested, and then your death certificate could be certified as dying with COVID after the fact. So that's that. All right, so I need to run off to a meeting, it sounds like. So we'll end for today, and we'll continue to compile your questions and concerns from Facebook and from the media and try to answer those when we talk to you again tomorrow. Stay safe and be well, everybody.